Welcome back to Show Me St. Louis. Now, statistics are showing Black women have been dying of cancer at higher rates than other groups. Now, the American Cancer Society has set out to study these concerning numbers. So here to share a look at this new study we have from the American Cancer Society, Tricia Newsom-Anderson, and from Siteman Cancer Center, Dr. Danao Cabelli. Thank you so much for joining us today.
Thank you for having us.
Thank you.
Okay, so this is frightening numbers. They're not really adding up. It seems that less Black women are getting cancer than white women, but there's a higher risk of death. There's higher numbers of deaths. So Tricia, why don't we start with you, the American Cancer Society. What are they hoping to accomplish from a study of this?
What they're hoping to uncover or cover is the fact that we are dying at a larger rate than white women. A lot of it may just be education or family members not talking about it or not having the right resources or knowing where to go to get resources for this education or for their health.
And so what is the study going to look at? I hear it's one of the largest really that you've ever taken on.
Yes. We're hoping to get at least 100,000 women between the ages of 25 and 55. So it's going to be a 30-year study, and it's a very easy thing to sign up for online, and the process is really easy, and there are no clinical trials.
Okay, wonderful. So Dr. Cabelli, when you hear a study like this, what's going through your head on why this is happening and really why it's such a concern?
Well, I'm very excited that the American Cancer Society is taking this on. 100,000 Black women in 20 states where the vast majority of Black women live is going to give us so much more information about what is happening in preventing Black women from getting the care that they need from Black women's voices. So I think it's really important. We know a lot of statistics and the systemic issues and institutional issues perhaps that are barriers.
Yes.
But this is really an opportunity to ask Black women themselves what's going on in their lives and monitoring and asking these questions over time, so over a 30-year period of time, and hopefully getting some real answers that will add to what we already know. Black women are dying at alarming rates because we're not getting enough access to screening. Once we get screened, the diagnosis is delayed. Once we're diagnosed, treatment is not completed or delayed. And that's because of a lot of reasons, systemic reasons, lack of insurance, lack of access. But we know if we get people screened, if we get all those other pieces in place, we can reduce rates. And so, for example, Siteman Cancer Center has this huge initiative working with people in the community to reduce breast cancer rates for Black women. And I'm really delighted to share that the incidence has decreased, mortality rate has decreased, not incidence, mortality rate, death rates for women in St. Louis City and St. Louis County, Black women, has been significantly reduced by about 30% over the past couple of years.
Wow, that's remarkable, and hopefully an initiative that other communities can start to take up as well. Well, thank you both so much for joining us today. And this really is an important PSA because you're looking for participants. So we're going to have that website right there on your screen, voices.cancer.org. And then, of course, you can go for screenings, yourdiseaserisk.com, assess where you are. Siteman has all of those online tools that you're not going to want to miss. As always, learn more, kck.com/showme. Thank you so much, ladies.
Thank you.
Thank you.
Thank you.